Good evening. This is Steve Ward with Doc Out. Thanks so much for joining. As you're joining on the chat, please let us know where you're joining from. That's always exciting to see and hear. Welcome to the program. Good to have you. You can search for Doc Out Official on YouTube, Facebook, and Instagram, or go to the website, docdout.org. You can always email me, steve@docdout.org. Be happy to write you back and answer any questions or comments that you may have. So I have some exciting, important content for you tonight. We've been talking about LGBTQIA ideology over the past several weeks, but tonight I want to hone in a little bit more and give you some depth on puberty blockers. What exactly are they? How do they work? What do they do? What are some of the dangers and so forth? And should we be using them? That's the really important question. And before diving into that, I just want to pause again, as we've been doing together, to remember that we need to have great compassion and patience when discussing these issues because it's so highly controversial in our culture right now. Well, that means we need to talk about it. We need to present truth and the scientific evidence in support of the Christian worldview in order to help others and to have that compassion and to be loving. Remember that to love requires that we share the truth with others. I have a special group of people in mind. First are the adolescents that might be struggling with LGBTQIA ideology, who might have gender dysphoria. But remember, there are also parents going through this who might not know what to do. There are pastors and church members who don't know what to do or what to say and might not have some of the background to really address these issues in depth with somebody to try to be helpful. So I want to try to give you more information tonight about gender affirming care, specifically as it pertains to the use of puberty blockers, and then moving on further to hormone therapy, possibly ultimately surgery. What does that mean? What are the outcomes? Do we have any data? All of those questions are super important to really get out there in the air. So I'm hoping to make some progress with you tonight. So parents of a child who is struggling with transgender ideology might feel, overwhelmed, fearful. You feel uninformed, not sure where to turn, confused, unclear who you can really talk to get accurate information. What do you do about affirmation? What is the truth about suicide risks in adolescents who identify as transgender? And what about the experts who will present puberty blockers as a safe and tested and reliable treatment method? And I think what makes this even more difficult is the fact that you might be called transphobic if you disagree with the ideology, or if you push back on the ideology, or just say that you disagree or have concerns. That can be very intimidating to a lot of people. So I want to help you try to get past that. But remember that most of the claims being made by activists in the LGBTQIA community, even healthcare professionals, are simply not true, or they're incomplete truths that are being pushed in the culture according to progressive agenda. There's social media influencers, there's all kinds of things going on. So this is a very complex issue. And at the end of the day, also remember that we're engaging in spiritual warfare. So the role of the church in this matter is of the utmost importance. Unfortunately, I think the church at large across the United States has been too silent on this issue, or in some cases has participated in the process of affirmation, or ushering people down this process of gender affirming care, maybe out of fear of being political, or not wanting to offend, or wanting to draw people into the church. But I would suggest that the way to better help people and minister to others is to show them that love and compassion by helping them understand the truth. And people need to know solid answers to these questions about puberty blockers and all the things we've been talking about because there's so much information out there to navigate. It's very difficult to do sometimes on your own. So here's an outline that I have for tonight. I'd like to give an overview of some transgender ideology, and then I'll explain what we know about the causes of gender dysphoria and how those people over time might do in terms of long term outcomes. I'll give you an overview of the normal physiology of puberty and then talk about the puberty blockers themselves as drugs and help you understand what they do, how they work, what potential dangers and side effects are when we disrupt puberty. And then I'll transition into an important conversation about some of the bioethical considerations of blocking an adolescent's puberty. So let's jump right in and talk a little bit about some of the underlying ideology that's behind this movement. So remember, it's naturalism or the idea that only physical things are really scientifically relevant or even exist at all. That type of worldview is really underlying a lot of this because there's the assumption that gender is fluid because of a biological basis or some type of a genetic basis that leads a person to be transgender. And we'll just assume that even though there's no evidence, because that's what we think. And we believe that we'll eventually find that genetic explanation, even though we don't have that explanation right now. That leads to tremendous bias in interpreting scientific information. So we need to call that out. And remember that the interpretation of data needs to be objective and unbiased, but then don't be afraid to follow it wherever it leads. But we need to do high quality research. Okay, the transgender ideology also assumes that children are able to make life altering decisions at a very young age. Puberty blockers and hormone therapy is being initiated in very young children, 8, 9 years old in some cases. And there's a movement now to push even earlier. But without the proper brain development that comes with maturity, a child is simply not able to understand the pros and cons of such a decision. And from a bioethical framework, you could even say that that violates the patient's autonomy, their ability to make that decision. And we'll talk a little bit more of that. There's another thought that gender affirming care is necessary to save the life of a transgender child. So we need to understand the truth about suicide rates. And we'll show that gender affirming care is actually harmful medically and emotionally. But over time, as somebody goes through puberty blockade, hormone therapy, and if they eventually go on to surgery, you follow those patients out over several years, out to 10 years, the suicide rates are actually the same. So this type of treatment doesn't work. It's just not effective. And I'd like to make the case that's because we're not treating the underlying mental health component that is such a big part of this. Okay, advocates of gender affirming care will say that gender dysphoria is not a mental illness and that it's actually inappropriate or unethical to give an adolescent the diagnosis of a mental health disorder because it's stigmatizing. I would argue that we need to tell people the truth and understand what is going on in order to have the most appropriate, safest, best treatment plan, regardless of what that plan might be. There's this idea that we have to focus on the child's feelings rather than the factual basis of what is going on by avoiding identifying a mental health disorder when it's actually critical to identify that as such. There's another claim within transgender ideology that dysphoria, if it persists in the child once you hit puberty and start to go through puberty, that it will be very unlikely to subside, that it'll be permanent dysphoria. And I'd like to demonstrate that that is actually not true. We have studies that show that as high as 80 to 95% of youth with dysphoria, true gender dysphoria, will outgrow that by the time that they're 18, and it goes away. And that has a lot of implications for the appropriateness of gender affirming care. You might hear the claim that hormone therapy is safe, that in children there are no significant medical complications of giving somebody hormone therapy. That's not true. And actually, puberty blockade plus hormones is something that you have to stay on in combination for life, unless you go on to have surgery. But this is a long term commitment. And there are many, many risks that I'll elaborate a little bit more on later in the broadcast. There's also a phenomenon that I think is important to know about. So there's a push to administer puberty blockers and hormone therapy to younger and younger ages, but with the full understanding that that's going to cause permanent infertility. And because of the infertility, now we have to have fertility preservation techniques available to young children so that later in life they might be able to conceive. So we're basically creating another medical problem and coming forward with another medical system or solution for people, when in fact, if we would correctly diagnose what's going on, that could be avoided, and a lot of the long-term complications of that type of care can be avoided. You'll hear some statements within the transgender community that it's okay that there's a higher risk of osteoporosis in children who are given puberty blockers and hormones. We just need to give them the higher dose hormones earlier to help their bones to mature. So that's also part of the push to transition kids chemically younger and younger. It's because of known complications. So a lot of the proponents will move and shift the whole treatment plan to younger ages. And I would argue that that is not appropriate and can actually be very harmful. There are complications to a patient's final height because testosterone and estrogen levels will cause fusion of growth plates during puberty, once you're to that end of puberty and finish your growth spurt. But that will be disrupted with puberty blockade, with very important permanent long-term implications for a person's final height. And finally, I want to leave you with this thought that the use of puberty blockers and hormones it's entirely experimental. Okay, there is no long-term safety data that compares psychological counseling against gender affirming care with hormones and blockers. There's no such study that we have. There's no evidence to show that this is safe. This is a completely experimental care plan. And I would argue that that is also not ethical and violates the principle of beneficence and non-maleficence, which I will explain a little bit later, in addition to just simply not being true. Let's talk a little bit about some of the philosophical kind of underpinnings or counter arguments that are based more in some of the natural law and laws of logic that we can use in conversation with people who might be struggling with LGBTQIA ideology. So here are some thoughts. So we know, I mean, science it knows, we know that there are two genders, male, female, sperm, egg. There's no third sex. There's no third type of gamete. And the purpose, biologically speaking, is for reproduction, right? Now, remember that the trans ideology is based on this denial of the spiritual reality where genetic explanation for everything and naturalism is a big part of what's going on. But if you think about this for a minute, just take a step back from that and think, well, if a homosexual couple or individuals who are transgender are together, can they have children naturally? Well, the answer is no. So let's say hypothetically that there was a genetic or there's a gene, a transgender gene. Well, if you believe in evolution over thousands or millions, billions, gazillions of years, you would have to make the case that those genes were passed on down subsequent generations and were maintained in the gene pool up until today. But if those individuals are not able to have children, then that wouldn't be a possible explanation, right? So the ideology itself is self-defeating in the sense that it is counter to what you would think to be the case if you believed in evolution. There are some other problems too. Think about gender dysphoria. So this idea that you have distress because there's this mismatch between your mind or your belief system and your physical body. Well, if gender is fluid and there are an infinite number of genders and you can, drift between any number of genders over the course of your life, then actually you would never have dysphoria, right? Because you would always be within one type of gender, and if there was some type of movement to a different gender, that would be fine, and you would feel well, you would feel as yourself, and there would be no dysphoria. Dysphoria by definition is a mismatch between the sex that you believe you are, male or female, and your actual physical sex, male or female. So it's the dysphoria itself that assumes a precondition of two fixed genders. So this idea is self-defeating, that gender is fluid and that there is dysphoria and that you can transition at all. Think about that. How can you transition from male to female or female to male unless there are two fixed genders as reference points for the transition process, right? You can't transition from a male unless you know what a male is, and you can't transition to a woman unless you know what a woman is, and vice versa. So the ideology and the definitions require and presuppose the existence of binary fixed genders, and even just to have this conversation. That's just part of the worldview that I think we need to understand and call out. And I'll leave you with this thought too. It's never possible to fully transition anyway, because you have to be on puberty blockers and hormones for life or undergo radical surgical changes. And you're also sexed, male or female, in every cell of your body, in billions of cells of your body. So it's just not possible to do. So this idea that a person has transitioned or is in the process of a transition and will complete this transition with this given treatment or this drug or this surgery is simply not true, because it's not possible to do so. So having said all of that, why are so many people claiming to be trans? This is huge and so important to try to understand. So historically, about one in maybe 10,000 boys would have gender dysphoria. But today, that has radically changed, an increase of about 4,000%, up to the point where now almost one third of girls in some communities, in middle schools, high schools, claim to be trans. So been a shift to adolescent boys, to adolescent girls, predominantly at much, much, much higher rates. And I think we need to think about that for a minute and try to understand why that might be. And I think culturally speaking, as we've seen the secularization of society, we have an identity crisis. We no longer understand ourselves to be made in the image of God, mind, body, and spirit, and so forth. And without that type of foundation, people are really left drifting to identify or create their own identity. And that's a big part of what is going on. Added to that is this culture that we can favor feelings over what is reality. And this is part of the postmodern thinking. It's in progressivism and it's just rampant in society, but it leads people down this path that if I feel a certain way, it must be okay. It must be true. That must be who I am. Yet we understand that feelings are unreliable and we should not just rely on our feelings. Of course, feelings are important. That's part of who we are. That's not what I'm saying. But when it comes to claims such as, your gender and your identity as a human being and who you are and who you were made to be, those things are given to us by our creator God and are not subject or changeable based on how we might feel. I think there's also this crisis of acceptance or love. People want to be part of a thriving community. They want to have friends. They want to be cool. They want to, feel like they fit in. And I think what we've seen in the collapse of the family is huge. And this might be difficult for some people to hear. And I don't mean this to be harsh in any way, but about two-thirds of individuals who identify as transgender have pretty significant underlying mental health problems. And there's often a trauma history. Now, this is studied, okay? So this information is available and is known. It's just not circulated through the culture in the media and social media. But there are very, very high rates of mental health disorders in people who um, are identifying as transgender. But here's what I want to try to explain. It's the underlying mental health issues that are causing the transgender thinking and the dysphoria, not the dysphoria that's going untreated causing mental health problems. It's the other way around. So it's the dysfunctional family unit as we've abandoned commitment to marriage, our understanding of the Judeo-Christian values of being created in God's image and so forth, basing our love decisions based on how we feel rather than commitment in a covenant relationship. We have just a lot of just devastating consequences, and here are some of them. But focus in your mind a little bit to complications that these things will have for a child in trying to understand gender roles. Okay, so in some of these studies of transgender individuals, what we've found is that many will have parents who preferred the opposite gender child. So there's this idea of favoritism of the other gender, causing a desire in the child to be the other gender. And then you have social media uh, activists who are trying to usher people into this community. There's peer pressure. There's also fatherlessness that is epidemic. Or if there is a father present in the home, that father might be emotionally absent. There's marital stress. Divorce rates are sky high. And parents might have their own anxiety issues, their own, guilt and shame issues about who they are. There's a link with mothers and depression. There's a link with neglect, and there's a link with kids who have been sexually abused. Okay, and think about a girl who has been sexually abused. What we're learning is that deep in the psyche, some of those girls don't want to grow up to be women, to be abused further by men. So that's part of this underlying desire to transition a girl to become a boy and then a man later in life. So you can't be abused. There's also the similar idea for boys who have been sexually abused, who deep in their psyche don't want to grow up to be an abuser or among abusers or to have the same sex organs that abused them. So there's this idea of a transition. There are some other associations as well. Fathers who are very cold tend to be controlling. There's a link with boys who transition to girls. girls transitioning to boys with over controlling mothers or parents that have made them feel rejected in some way. So my point is, this is complicated. We must respond with compassion. The trauma is real. The trauma is real, and we have to remember that. This is a lot more. There's a lot more going on very, very deeply in this community that I don't think the social media platforms and the general mainstream media is really doing a good job of exposing and explaining. And certainly in the medical community, we're not getting these people the help that they really need. So there are some other mental health considerations. So there's a link with gender dysphoria and autism that's not fully understood, but I'll just leave you with the idea that it's really the underlying mental health disorder that's leading to distress and identity crisis, thoughts of transgenderism, dysphoria, and so forth. That's the direction. It isn't a biological genetic basis where somebody is born a different gender or there's a mismatch, and then you become distressed because nobody else affirms you through it. That's not what's going on. All right, so I hope that makes a little bit of sense and is helpful to you to give this a little bit of kind of a broader context. So transgender ideology has led to two predominant theories about how this originates. So one of them is that in the womb, the embryo might be exposed to higher levels of testosterone or estrogen that will then later lead that child to become transgender or to be transgender. So I want you to understand that there's no evidence for that. That's a theory, but it's really not. It depends who you're talking to or listening to or reading. You might hear more about that, but it's really not something that has any evidence behind it at this point. The other theory that has taken more foothold is that there's this idea that there's a biological structural brain difference in the actual neuroanatomy of a transgender individual. And that is really what is causing a lot of the gender affirming care to really take off. It's assuming that there's a genetic basis in the actual brain structure, but we actually have evidence to the contrary. It's just been suppressed evidence that you don't hear much about, but we have evidence in monozygotic twin studies. Those are identical twins. So same genes, same mother gives birth to both, same genetic makeup, exactly genetically identical. But one child grows up in one home with a different family set of, emotional, psychological structure. The other child is raised in a different home with a different environment. One becomes transgender, the other does not. So if you think about that, I mean, that basically is telling you that does not have a biologic basis, right? Because if there was a genetic biological basis in the brain structure, both identical twins would be transgender. But that's not what happened. It was the result of the child's environment after birth that caused the transgenderism. That's so important to understand that our brains are actually not fixed for life, really, at any point. Even when you're elderly, we're always learning and doing different things. And that concept is called neuroplasticity. Basically means that the structure, the neurologic connections between the nerve cells in your brain actually change and grow and develop and make new links all the time through our lives. And in response to our environment. So our thought patterns will actually cause changes to the brain structure and will change your behavior and how you think and what you do. And this makes biblical sense. So let's go to Romans chapter 12 here for a minute, verses 1 and 2. I beseech you, therefore, brethren, by the mercies of God, that ye present your bodies a living sacrifice, wholly acceptable unto God, which is your reasonable service. Okay, and in verse 2, This is super important. And be not conformed to this world, but be ye transformed. How? By the renewing of your mind, that you might prove what is that good and acceptable and perfect will of God. Okay, so we are actually to renew our minds, but what does that mean? And how does that work? How do I renew my mind? And often we hear about, well, reading the Bible and prayer. And yes, that's all part of it. But our behavior, our thought patterns, the way we think, what we believe, how we teach ourselves to think becomes hardwired. And I'm going to get into that a little bit more, how that actually works. But basically, we're making new and stronger connections between the nerves that we use the most, and the nerve connections that are used the least tend to fade away and become less active. So your brain is structurally different based on how you think and what you do. And the idea that you can change that, we call it remodeling, is because of this phenomenon called neuroplasticity. The idea that there's a structural framework, there's organization, there's all kinds of neurochemistry going on, but there are interconnections between the neurons of your brain that are either stronger or weaker based on your thought patterns. That's renewing your mind to get your mind focused on the things of God, spirit, things that are of spiritual benefit to you will actually change the structure of your brain physically, not just in a spiritual sense. So we have the mental health issues leading to the transgender type of thinking, which then lead to brain changes. So there's this thought that, a lot of research scientists now are looking for differences in the structural brains of a transgender person versus a normal individual. Well, eventually, yes, we probably will find some structural changes, but it's not because of a genetic defect. It's because of the thought patterns over years and hormonal changes and puberty blockade that has altered the structure of the brain and remodeled it due to neuroplasticity, which has caused those changes. If that makes any sense, that's kind of that's where we're going with this concept. So puberty blockers will cause a self-fulfilling prophecy. And let me try to explain what that really means. So puberty blockers will alter brain development and can actually make your dysphoria worse, leading you down this path of further transition and wanting to transition stronger. So initiating the puberty blockade will actually propel somebody further and more deeply down this path of transition. And that's the self-fulfilling prophecy that I'm talking about. But there are also very significant and important bioethical violations going on here that we'll get to here a little bit later in the program. So let's talk a little bit about normal puberty. Okay, the physiology of normal puberty. So puberty in a general sense is becoming sexually mature, but there's so much more going on in the body during puberty that you might not have really been aware of, but it's critical to this conversation of transgenderism and whether or not we should be doing hormone therapies and puberty blockade. Okay. And the first concept is that the timing of puberty for your brain development and other things is critical. So puberty, generally speaking, is occurring at younger ages in society. And we think that's because of obesity and the hormone changes that occur during obesity. That's under study. That might be part of it. There might be other factors, but that's a thought. But the idea that puberty occurring younger or later than when it is supposed to occur will actually cause self-esteem issues, will disrupt growth patterns, height and weight ratios, and ultimately behavior. So it's the disruption of puberty with blockers that can make this worse and actually leading to a worsening or a masking of the underlying mental health issues. But then people within the trans ideology will say, oh, well, that means we need to move forward further and faster with a transition to high dose hormones or surgery, when that's actually not the case, because that's not the underlying problem. The underlying problem is not with the body, it's more with the mind. So let's dig into that. So um, puberty is really launched in the hypothalamus of the brain. There are a lot of really unknown factors that kick this off, but the hypothalamus will release two primary hormones. Gonadotropin releasing hormone, or GnRH, is one of them. Adrenocorticotropic hormone is the other. ACTH is the acronym for that. They are both active and upregulated during puberty. So what does GnRH do? Well, it's released in a pulsatile manner by the hypothalamus, and that stimulates the pituitary gland to release two distinct hormones: FSH, that's follicle stimulating hormone, and LH, luteinizing hormone. Those two hormones will act to mature the gonads and allow proper maturation of sperm and egg. The ACTH acts on your adrenal gland to produce androgens, the steroids, mineralocorticoids. So you have blood pressure changes, you have increases in the aerobic capacity, muscle tone, you have acne, and axillary hair, chest hair, and so forth. Sweat glands become more active, and then the testosterone surges cause inflammation of the sweat glands, and that's how you get the acne. So there's a lot going on, but my point is to try to explain that you have this gonadotropin releasing hormone in a pulsatile manner, which causes release of the other two, FSH, LH, which will then lead to normal production of testosterone and estrogen, and that leads you down the path of secondary sex characteristics, is what we say. So that's breast development, deepening your voice, all of those other things that I'll touch on a little bit later. So FSH, the follicle stimulating hormone, will stimulate the ovaries to develop their follicles, start developing the capacity to release eggs. Estradiol from the ovaries has a lot to do with skeletal growth, breast development, the maturation of bone, the fusion of growth plates at the proper time, and then combined with progesterone, that interaction causes the beginning of menstruation for women. In boys, the FSH causes the development of seminiferous tubules. Those are the areas where sperm will be developed. So super important. LH, luteinizing hormone, is active in the Leydig cells of the testicle, and that's where you get testosterone production that does the other things like, deepening the voice, hair, muscle mass, and other things like that. So keep that in mind. This is a very dynamic system. There's a lot going on chemically, but not just sexually, also in the brain, in the bones, in your heart and lungs, really systemically, head to toe in all of your organ systems. Puberty is a growth maturation process. It doesn't just impact the sex organs. So if you block FSH, LH production, everything else still progresses, but in a blunted manner. And I'll explain that a little bit more. Now, women without the testosterone surges that a young man would have is going to have a different muscle to fat ratio. That's normal because women have a higher fat composition by design to allow it for energy stores for childbirth and lactation, forming breast milk. So that is completely normal. Bone health, let me touch upon that. Super, super important. So your bones grow during puberty, and your growth, you're growing all along, but then in the growth spurt. So there's growth, And then there's mineralization that occurs next. And then the bones become progressively more dense or more thick. But if you block puberty, you don't have the hormonal stimulation for this process to occur normally. So, what we see in adolescence is osteoporosis, which you see on the right. It's basically a less dense bone, which has not mineralized and become dense normally. So we have young children at a higher rate of fracture. Okay, so increased fracture risk for these young kids. Um, but remember that this is actually a permanent change. So this is permanent damage, okay? Because puberty is a fixed window of time where the hormone cascades are able to make structural changes in your bone and your brain and elsewhere. And once that window passes, when you're an adult and get older, you can't just give somebody an injection of testosterone or estrogen and reverse those things. It just doesn't work that way. The window is closed. And that's one of the dangers of a puberty block, is that you cause permanent harm to other organ systems, as well as shut down uh, the gonads and causing permanent infertility. So this is, it's a very serious matter. So to say there aren't permanent changes is just plain wrong based on the physiology. Now, girls typically start their growth spurt a couple years before boys, and then they're done. The estrogen levels fuse the growth plates, and they're done. Men, boys, going through puberty, they're growing progressively for those 2 years, and then they have their growth spurt on top of that. And that's how boys tend to wind up a little taller. And then, given the higher doses of, higher concentrations of testosterone, the growth plates fuse and so forth. So, you don't want to give a young adolescent a puberty blocker and then high doses of hormones, because you're going to fuse their growth plates and stunt their growth permanently. So there's a lot of discussion about how do you, select the timing of how to administer hormone therapy and to initiate the blockade. What's the child's ultimate goal for their end height, as either a male or a female that they're trying to transition to? All of these different considerations that a child is honestly just doesn't have the capacity to make those types of decisions. And we're certainly battling your normal physiology in an unhealthy way. God designed you to be a certain height in adulthood, and we want to get you there. All right, let's shift gears a little bit more. I want to dig into the brain development issue, because I think this is really key to just understanding what's going on with these puberty blockers. So in the womb, and also right after birth, in those first few months, there's a lot going on biochemically. Okay. So the sex steroids that your brain is exposed to, even in the womb and shortly after birth, is going to shape your brain structure and activate certain neurologic circuits in your brain permanently that will basically cause a male brain or a female brain. So your brain becomes sexed physically and structurally, even in the womb. And then the sex steroids later, as you are growing, puts down myelin sheaths around the neurons, or the axon of the neuron, which allows for proper sodium potassium conduction, nerve conduction along the axon for nerve signaling. So these myelin sheaths are sex steroid dependent. And then we have synapses that form. So this is an illustration of the connections between neurons, where we have the nerve signaling coming down, and then a cascade of chemical reactions and the release of chemicals that are able to act on the neuron that's right next to it in that synapse to receive that information and then propagate the signal. That's a very important way that our nervous system communicates with one another. Those synapses are developed structurally in the embryo and right after birth, in this process of pruning, where the synapses that are used more are more well developed and linked. The connections that are used less are not as well developed and will fade away and not be as active. We also have structures called dendrites, which are these, they look like tentacles around the neurons that allow for this web of neurologic connections to form. Okay, those are also sex steroid dependent, and actually it's estradiol that changes these structurally, and we see that even in the menstrual cycles of girls. These structures will actually change. We also have epigenetics going on. So these are proteins that are attached to the DNA that actually turn on or turn off the genetic transcription of certain genes. This is sex steroid dependent. And there are estrogen and testosterone receptors that are expressed differently in boys and girls that will be structurally permanently embedded in the brain so that later in life, the hormones will have certain activity that you're prepared for. Okay, so then launching into what happens during actual puberty, it's basically similar things, just at a much steeper, more higher level. So we have this temporary window of opportunity of neuroplasticity that really accelerates these changes. And in boys, we have development within each hemisphere of the cortex, and which actually allows task execution to be more developed. And that's associated with the higher rates of risk taking, the immediate reward centers, and so forth. And then in girls, we have increased communication between the left and right hemispheres, which is more associated with the intuitive thinking process, analytic skills. And this is basically a hard wiring for women to have more empathy, more of an empathic type of thought process that is God's design for women for having children. So girls, even in the womb, shortly after birth, but certainly in the course of puberty, have a distinctly female brain, and boys have a distinctly male brain. And there are other aspects too of, the action of estrogen and testosterone changing the cortical volume of certain structures that just have to do with the different types of behavioral characteristics, spatial learning, visual learning skills. Those are different between boys and girls. And we see that structurally, and it's because of estrogen and testosterone effects that have been laid down early in development. It's not possible to block that because your brain is already structurally different at birth, after the first several months, and then certainly in puberty, those changes accelerate, but is already wired. So puberty blocking causes this loss of opportunity for brain development. And we know that because after girls go through puberty, if you give them testosterone, they can actually become more depressed because their brain is not structured to receive and act on high doses of testosterone. Likewise, boys that are given testosterone at higher doses later, after puberty, do not see improvement in some of the visual and spatial type of orientation that might have been impaired earlier by a puberty blockade. And the reason is simply that the window of opportunity of that neuroplasticity has passed. Okay, so what actually are puberty blockers? The GnRH agonists, that's what they are formally called. So this is your leuprolide, gazerelin, naferelin. Those are the chemical names. So these are FDA approved for precocious puberty, which is a very specific, distinct physical disease that has a lot of risk associated with it. Ovarian cancer, prostate cancer, diabetes, cardiovascular disease, hypertension, and it's also used in the treatment of several cancers, breast cancer, prostate cancer, notably, because those tumor cells usually have estrogen and testosterone receptors. So you want to block those, and that prevents tumor growth. So those are reasons that GnRH agonists or puberty blockers would be used properly, FDA approved, for this specific disease state because of an abnormality physically as opposed to trying to treat what we know is really an underlying psychological disorder. Puberty blockers are not FDA approved. They are experimental. They were not designed to block puberty. They were designed to treat cancer or children with precocious puberty that start their puberty abnormally early, to stop that until the proper time, and then you allow puberty to occur normally. It's not to transition anybody. So puberty blockade is entirely experimental. There is no long-term safety data. Okay, so I want you to really understand that there is no long-term safety data. There isn't any. The reason you don't hear about it is because it doesn't exist. Okay, yet we have endocrinologists that are saying that this is safe and studied and reversible and so forth. It's safe for a specific purpose that it is FDA approved for, not for gender dysphoria. So what these drugs actually do is shut down, it desensitizes the pituitary gland, so you no longer produce FSH and LH. And when you combine that with high doses of testosterone or estrogen and hormone therapy, you cause permanent infertility, because you basically don't allow the gonads to mature normally, to grow and develop. So they're reversible in the sense that if you stop the drug, the hormone cycles of FSH, LH start again, but they're not going to be effective. And then you have high doses of hormones on board as well, providing negative feedback, which shuts down the process even further. So this causes permanent infertility. But in the process of taking the puberty blockers, you block everything else, like the brain development, cause osteoporosis, and so forth. Now, there's a common idea that, well, if a child isn't sure what they want to do, you can just give them puberty blockers to buy time. You hit pause on time to allow the child to decide if transitioning is really what they want to do. But remember that we're also halting brain development, and we might be masking underlying mental health disorders and causing dysphoria to become worse. That's a problem. Okay, and I think that to me is just a showstopper, where we have medical experts saying, well, it's okay, you can just discontinue a puberty blocker anytime. We'll just give it to you for a little while to buy some time. No, there's much more going on developmentally during puberty than only developing secondary sex characteristics that might be associated with dysphoria. All right, we talked a little bit about growth plates. So I think it's clear that there's some very real harms going on with this gender affirming care. Let me wrap it up here with a little bit of a discussion about bioethics. So traditionally in the bioethics world, okay, so the medical system uses 4 tiers, 4 different classification methods or 4 different concepts to really understand ethical considerations. So the first one to really know about is called non-maleficence. This is your do no harm type of principle. But I think we've demonstrated that gender affirming care actually is harmful, and that to wait and allow a child to naturally outgrow. Remember, 80 to 95% of transgender adolescents will desist or outgrow their gender dysphoria. Allow us to focus on spiritual care, psychiatric care, but we're told that this is transphobic. But remember, this gender affirming care is a violation of the bioethical principle of non-maleficence, which has been at the core of the healthcare system ever since the beginning. The next concept is beneficence, which is basically the idea that we should be doing things within the healthcare community that is beneficial to others. And this allows parents the authority. I mean, they have the authority anyway, but this just reinforces the fact that parents, teachers, pastors, peers, we should all be wrapping ourselves around adolescents who are struggling with this and be the gatekeeper. And that term is being misused and being used to call people transphobic. But no, we don't want people to go down a path that we know is going to be harmful for them. That is acting with beneficence. So those two ideas, non-maleficence and beneficence, have been really at the core of what it means to provide excellent healthcare to another individual with compassion. But there are two other factors that have really taken over this idea of autonomy and the idea of justice. So in progressive thinking, again, we're getting back to the ideology that's driving this. Autonomy is number one. Basically, the healthcare system now largely thinks that we should just let people do what they want to do based on how they feel. It's a significant problem, especially when it comes to procedures or getting medications prescribed to you, because you have to provide informed consent. But if there's no long-term safety data, if minors are unable to comprehend the long-term ramifications of their decisions, we have healthcare individuals with conflicts of interest who stand to benefit financially from, a whole industry of gender-affirming care. We have safety data. We know that suicide rates do not improve following gender-affirming care over time. And we have the self-fulfilling prophecy concerns. We have brain development concerns, known harms. Yet we put the feelings of the individual as number one rather than what is best for them. That is a violation of patient autonomy, the inability to provide informed consent. There's also the consideration of justice. We know that 80 to 95% of youth with gender dysphoria will outgrow it. Yet the costs are staggering. It costs upwards of $1 million per individual to undergo a lifetime of gender affirming care. Is that a just use of resources? And is it equitable to that person? Is it treating them with compassion and care? I would argue no. So we have just a lot going on, a lot to consider here. But I think our overall response as Christians, especially, is to love, to support, do no harm, accept people where they're at. The trauma is real. Remember that. Have compassion and love, but that means that we need to tell people the truth, pray, enter these people's world, engage in relationships, develop friendships and relationships. Because one day they're going to call you or they're going to seek somebody for help and they're going to wonder who loved me enough to try to help me, even though I might have turned them away. Who can I rely upon? Who is there now that I can turn to? Maybe they'll think of you. So I leave you with that challenge. Let's open it up to any questions that might be out there. Happy to take those questions and comments at this time. Appreciate everybody listening to the program. We'll pull those up here. Raul, I've heard about neuroplasticity. Pretty interesting stuff. Yes. So this is an area of huge neuroscience research. So, people are interested in, what's going on, some of the hot fields in medical research. Neuroplasticity is one of those things. And the reason is that, with other organs like your liver or, you have your gallbladder taken out, your appendix taken out, it's easy to biopsy some other part of your body. You stick a needle in, take a tissue sample, look under the microscope, do some special stains, get a lot of molecular information. You can't do that with the brain, right? I can't just stick a needle into your brain. I'll give you seizures and a stroke. And, so I think this whole field of neuroscience has lagged behind a little bit compared to some of the other fields in medicine, simply because, you have to ethically do the studies. So some of this is coming out of animal studies, mice and whatnot. So there's a lot going on. It's fascinating. But what I really get excited about is that the Bible was the first to explain this, right? The renewing of your mind. So this is God's word. This is God's truth. it's really science. It's us that is thousands of years late catching up to the Bible, where the Bible was. So it's this lining up of science and scripture that I think is really fascinating. And it just, to me, reinforces my faith that the Bible is reliable, even though it's not a science textbook and it's not going to lay out all of these different molecular things. It doesn't have to, but it's telling you the truth. And we can study the world around us, the general revelation, and come to the same conclusions. All right, Raul, what would be the best way to share this information to a lay people within a church without generating panic, which would be detrimental to the cause? Yeah, really good question. I think, well, I guess it depends what you mean by the panic. So I think there can be panic in the sense that, oh no, we're going to talk about something really controversial, and I'm going to turn off, most of the congregation. People are going to think I hate them, and they're going to think I'm transphobic. So I think there has to be a lot of groundwork done first with people. You just have to love them and get to know them, and then ask a lot of questions like, hey, have you considered this other evidence that we have? Have you thought about this or that? Or, why do you believe this or that? So I think really just engaging in the conversations. But from the pulpit, like in a message, I think you just have to say, like, hey, this is really difficult stuff. And there are people you're going to encounter. Maybe some of you are going through this, but I love you. That's why I have to help you with this, and just lay that groundwork. And I think what we're starting to see is that people are thirsty for the truth. People want to know the truth. They want their church to tell them the whole story completely, and to give them the information and the answers that they need. So maybe some people, or hopefully few or none, but maybe some people would leave or be offended. But I think that church would be rewarded by an inflooding of many who really want to hear the truth of what's going on with some of this. So I would say, don't be afraid. It's always the right thing to go into the details of what's going on and try to be a help for people for edification purposes. But great questions. Appreciate those. All right. Chat in if you would, where you're from too. That's always fun. We've had people from South America, Mexico, um, here within the US, Canada. It's been pretty exciting to see. But that's all I had for tonight. Thanks so much for coming. Share the content if you will. Click subscribe so I can get the content to more people. Trying to help people the best that I can. So if you would share the content, appreciate it. Thanks for coming, and look forward to our next time together. Take care.